Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr. And as many of you know, October is National Depression and Mental Health Awareness Month. Today, we are talking with a registered nurse and integration specialist from Guild Services. We're going to talk about mental health and the work that they offer to long-term homeless people here in the community. This is going to be a poignant episode you won't want to miss. Stay tuned. It is wonderful to have you joining me today, Balan Abdisalam. You work with Guild Services. Can you talk to me about what the work of Guild is?
Of course, yeah. Thank you for having me here today, Anna. Guild has a variety of different services. We offer employment services. We offer mental health services on different aspects, as far as we have different programs. One being TCM, which is deals more with clients who have frequent hospitalizations. And then we also have a different program that's called BHH, which prioritizes clients who are not frequently as hospitalized, but may have different needs. And we've tried to tailor those needs to each individual client. And that is the program that I am a supervisor for.
Okay. And how long have you been doing that work for Guild?
Yeah, I've been, I would say I've been a nurse now for about 9 years, but I've been with Guild for about the last 5 months.
And you were talking about the program you work for. You are a registered nurse.
Correct.
But you also are an integration specialist for this program. Can you explain to viewers what that work looks like for a program like yours?
Of course, yeah. The integration specialist the role is a very, I would say, unique role, because it ties in the part of me being a nurse, right, and having that clinical background and giving the team some medical and clinical background for clients, as well as that supervisory component to help lead the team and guide them as far as when it comes to clients' clinical needs. And so the integration specialist's role is really to integrate those two different components into one.
I think that's really important. Now, you all have a footprint where you all work with not only folks that are dealing with mental illness, but people that are also long-term homeless residents here across the state of Minnesota. I think that's so important, not only because it is October, but because we know that here in our state, as well as globally, there is such an issue regarding homelessness.
Right.
What have some of the points of opportunity been in the community, or some of the feedback you've heard from the community regarding the work you guys are doing?
Yeah, and so you bring up a really great point. And, you know, homelessness and mental health are actually go quite hand in hand. I think a lot of people don't know, but a lot of people who are homeless are either, you know, going through some mental health struggles, even let's say that they weren't before, right? Even, you know, being homeless can cause some mental health struggles as well, being, you know, whether it be anxiety, depression, right? If you don't have somewhere to live, it can be really hard to function. So the way that, you know, Guild tries to empower and, you know, tailor our program to meet clients really where they're at. We try to, you know, see, you know, what we can do. So our services can differ depending on what the client's needs are. And I think the community has really sought out that we've been helping them quite a bit, you know. One of the things that we do for clients who are homeless and they aren't able to get some of the paperwork or mail that they get mailed to them, we provide an address for them so that they can come and pick up their mail at Guild. So that's one of the few ways that we've been helping the community out.
I think that's so important. You spoke to more of the cause and effect and how things necessarily go hand in hand. How can I work on my mental health if I'm consistently consumed with where am I going to live or what am I going to eat tonight?
Right.
I think it's very important for you all to offer not only those wraparound services, but also start to create some stability. I don't think I've heard of a program that creates an address for someone to be able to start receiving mail. We live in the digital age, so where people are consistently trying to fill out forms or keep up with documentation, sometimes if you're not able to have a residence, it almost seems like a catch-22 to start to rebuild your mental health, let alone stabilize your housing situation.
Exactly, yes. And so that's one of the few things that we do to kind of help as far as, creating an address for someone. And there are a lot of other things as far as employment services, right? Because one of the ways, as you know, if you don't have a job, it's really hard to have a stable place to live. So we offer those employment services so that someone is able to look for a job that can meet their needs, or maybe a job that can fit. Maybe a 9 to 5 is not practical for you right now, but it could be in the future. So working on what can we do right now to help you get it back on your feet.
I think that's important, one step at a time. Now, I was doing a little bit of research, putting together some information for today's interview, and I found this of note to be of sincere importance on your website. It says, Guild's mental health services are integrated, meaning the programs work together to provide clients with continuity of support. They are holistic, meaning they treat the whole person and recognize that mental illness impacts all areas of life. They are person-centered, meaning the treatment approach is determined by the needs of each individual, and they are community-based, meaning we come to you where and when you need help. I think that is so important because we know that not one size fits all when it comes to many things, let alone mental health. And just because you may have encountered someone dealing with anxiety or bipolar disorder or schizophrenia, that doesn't mean that it'll show up the exact same
Correct.
in someone else.
Right, exactly. How bipolar shows up for one person won't be the same way that it shows up for someone else, especially, if they're at the beginning or in the middle of their treatment, or if they're getting treatment at all. So it really does depend. And yeah, we do try to tailor services depending on what's going on in your life right now, as far as, like I had explained, there is BHH and then there's TCM. And so the program that I'm currently supervisor for is the BHH program. And what's unique about the BHH program is that a lot of clients sometimes feel that maybe, that I'm doing great right now. I've got my meds, I'm taking them daily, I feel stable. And sometimes they might kind of feel like they don't need help right now. But the great thing about the BHH program is that even though we do work with clients who are more stable and are not going into the hospital as frequently, we still follow up with those clients, and we try to make sure that we try to prevent them from going into the hospital or prevent them from going down that spiral by checking in with them monthly. And so I think that's a very unique program where we really strive on prevention. And as you know, prevention is huge on a huge way to make sure that clients are not hospitalized and that we avoid unwanted outcomes.
Now, you spoke about the Behavioral Health Home Program, and then you referred to another program. Can you explain what that acronym is for people that may not be familiar?
Of course, yeah. So I talked about the Behavioral Home Health Program, and then there's also another program that's called TCM, which is Targeted Case Management. And this program is more for clients who are more frequently hospitalized, I would say more than 2 times a year, and they might need a little bit more help. And so we have case managers who are ready to address some of those concerns with the client. I would say the difference between TCM and BHH is that the more frequently going into the hospital is the part that we are trying to prevent. And so the programs are, you can still have schizophrenia or bipolar and be in either program, but it's more about the frequency of hospitalizations that TCM specializes in.
Thank you so much for that distinction. Now, talk to me about how the work of Guild collaborates with local leaders and organizations to encourage mental health awareness and support long-term homeless populations.
Yeah, we have a lot of different, I would say, connections with local leaders. One of them being NAMI is a connection that we have. And another, we have different connections, I would say, with different organizations in the community, but we really strive to connect with the community as much as we can by hosting our own events and getting out there. And I would say, even doing this interview today and, getting to know different populations, we really strive to kind of bridge that gap.
I think it's so important to have existing community partnerships, or at least be open to existing community partnerships, because there are, like you said, so many different populations represented here, but also I know that we are often better together in being
Correct.
able to navigate each other's clientele and discover new ways of doing things or improve on old ways. Not only helps us understand the scope of people you serve, but also improves that scope. Talk to me about what efforts ensure all education materials are culturally and linguistically relevant to the East African population. We know that they have a very large footprint here.
Yeah. One of the ways that we try to bridge that gap is that a lot of our materials and our documents are transcribed into different languages. The East African population has quite a few different dialects.
Right.
And so we've tried to meet those needs by translating our documents into those different dialects, and not only for the East African community, but for other communities as well. One huge factor that prevents people from accessing healthcare is knowing about it, as well as being able to access and read. And so I think by us doing that, it's kind of helped bridge that gap.
While you all are bridging the gap, can we talk about some of the ways that Guild is currently engaging minority communities?
Yeah, I would say one great way, I think, is when you see yourself in some of the people that are helping you or who want to help you, you kind of feel a sense of belonging. And so our case managers and a lot of our team is very diverse. And so our clients can see themselves in some of our case managers. They might have similar backgrounds or maybe have similar stories. And so they're really able to be there to help and guide them through whatever is going on. I myself am Somali, and I know that in the East African population right now, there's quite a few people who are from the Somali background who, want to hear someone say, hey, I know what you're going through, and I'm here to help you and try to navigate this with you.
We know that representation really matters, and I don't know about anybody else, but I breathe a little bit easier when I walk into a space and see someone that looks like me or looks like you, even if it's just we're both two women in a space, versus kind of looking around and you're like, I don't see anyone that reflects my population or my community here in a space. So I'm sure that it puts clients at ease as they try to navigate some really daunting experiences going forward.
Exactly.
Now, do you know of any current plans to increase the work of Guild within the East African community?
Yeah, one of the events that Guild hosts and is going to be hosting this year is called Ladder of Hope. And Ladder of Hope is one of our Guild opportunities where clients are able to come and share their story and talk about some of the struggles they went through when they first started with Guild, how their life has changed and what Guild has done to help them. And so this event is going to be coming up here soon, and it can be it can help guide some of our clients or soon to be clients, and when they see this air and they see some of the stories and how Guild has helped, hopefully it can show them that if they're going through similar struggles, that they're not alone and that there are other people out there who maybe have gone through what they're going through and they can see themselves in that.
Is Ladder of Hope taking place in the near future, or is it coming up around the top of the year?
Yeah, it should be coming up in the next couple of months, and it should be posted on our website at guildservices.com. And you should definitely, if you're able to look on the website, you'll be able to see that.
Thank you for letting us know how we can stay connected to you guys. Now, you talked about Guild being out in the community and going to participants, meeting them exactly where they are out in the community and giving them support in that way, from the TCM program, is that correct?
Correct, yeah.
As well as the Behavioral Health Home Program.
Yeah.
But talk to me about how you all are reaching long-term homeless populations out in the community and promoting mental health awareness directly, one-to-one, or in a community setting, if we know that people are struggling with being stable or sometimes struggling with being in one area at one time.
Yeah, we're actually working on hosting some events at Guild where people can come and join and learn about our services, and it's going to be more of a drop-in session style. And so we're hoping to have that coming up in the next couple of months. Another way that we've been, hoping to strive for change in the community is by participating in Homeless Day on the Hill. And that's where we go to our politicians' offices, and we actually try to advocate for policy change. And so that's another way that we've been trying to help.
That's so important to have civic leadership understand the plight of its constituents, as well as know what it's like to be a service provider, like someone like yourself, and giving them some feedback on what your experience is like, but also how you all can give them some foresight on what needs to be changed long term.
Yeah.
What type of support you all need.
Exactly.
Now talk to me about how you all at Guild have used ethnic media and/or social media to promote the work that you guys are doing.
Yeah, we have quite a few different social media handles, and we are on Facebook, we're on LinkedIn, we are on Instagram and YouTube, and our handle is the same on all of them. It's at Guild Services, and we try to promote our stories, we try to promote different things that we've done in the community out on social media, because obviously nowadays everything's on social media, right?
Absolutely.
And that's really the push. So that's our main way of getting the word out.
Now, Balan, you spoke to me about being a registered nurse, and we talked a little bit offline about your background in the healthcare field, and you shared with me you are part of the Somali community. But what keeps you personally connected to this work?
Yeah, I would say there's been quite a lot. One story that all of us from the Somali community can resonate with is the fact that there was a civil war in Somalia, and being that there was a civil war, there was a huge migrant population that immigrated from Somalia to America. And so being that a lot of people are struggling with, PTSD from the war and maybe other mental health illnesses that have occurred from that huge migration, it affects the population today in ways that some people may still not understand, but are, coping with some of the repercussions. And so it does personally affect me, because seeing in the community how people are affected by it, it really speaks to my heart to help the population as much as I can, and help people. Being that I think most people from the East African community have migrated here and are, dealing with different, even as something as simple as just weather changes. In Africa, the sun's always out all the time, and here, there's a lot of people who are lacking vitamin D because we're not out in the sun like we used to. So there's just a lot of changes, and I think that working together to kind of figure out how we can help each other out is part of my passion and my goal.
Absolutely. Now, you spoke to us a little bit, but how do you see yourself navigating trying to reduce the stigma around mental health awareness or long-term homelessness? Because we know sometimes our communities aren't as open to having traditional services for whatever reason.
Yeah. And I think because I think in general, it's been a new turn in general for everyone to, understand, when they're feeling down, has this been going on for longer than normal, or is it just, we all have our bad days, right? Mm-hmm. But depression is actually characterized as something that's been going on for more than a month or so, and that it's affecting your life, right? So kind of taking that deeper turn and looking in. But I think that, getting the word out is a huge part of it. I think when people are able to see other people's stories and feel that they can resonate with that, I think part of that is, getting the word out and being able to see it and kind of resonate with it. I think that's a huge part of us getting the word out.
I think that's really important. Now, for anyone that is interested in staying connected to the work you guys are doing, you did provide us with you all social media handles as well as with your web address. But I just want you to take a second and look directly in this camera and just talk to someone that may be experiencing mental health issues, or start to say, you know what, I do want to start to get a handle on some things that I feel like have existed a little bit longer than normal, or maybe dealing with long-term homelessness, and give them some tools, but also let them know where they can find you guys to receive some support.
Yeah, I want to let you know that if you've been noticing lately that things are not sitting right with you, if you're noticing that maybe you are becoming more forgetful, or if you're noticing that you feel sad more days than normal, I want to let you know that you're not alone, and that what you're going through is something that a lot of people go through. I want to let you know that there are services out there that can help you. And if you take a look at our website at guildservices.org, you can actually go, and there is a contact us button where you can fill out some paperwork, and we can take a look and we can give you a call, and we can help you kind of navigate what you're going through. So I want to let you know that there are people out there who are dedicated and who are willing to hear your story out and help you get the help that you need. You can find us on social media, on Facebook, on Instagram, YouTube, LinkedIn, or Facebook at Guild Services.
Thank you so much for joining me, Balan. Unfortunately, that is all the time that we have for this episode of Community Connections. I want to say thank you to Balan for joining me today, and to the amazing people at Guild Services, NAMI, and their other community partners that are making sure that people in our population are not struggling with long-term homelessness and or mental health alone. Please be sure to take care of each other, and if you are worried about your mental health or about your stability with housing as the colder months approach, please make sure that you connect with Guild Services. As always, I am Anna Orr. This has been Community Connections, airing right here on OROMIA11. I look forward to connecting again with you soon.